So with me here is Ruth. Ruth has an incredible story to tell. So she was legally blind, severe diabetic, but anyway, I'll let her tell your story. So what kind of problem did you have when you first came to see me?
I couldn't bend over, and I was very, very acidic, and
First, let me summarize. Okay, you could not bend over. You could not put your socks on for decades.
that's a long time. No, I couldn't bend over, put my socks on.
You were legally blind.
I was legally blind.
So you could not vacuum because you could not find the.
I couldn't find the outlet to put the plug in.
And you cannot pick up the coins when you lose a coin.
That's right.
Okay, and then you fell all the time. What?
That's true.
11 times in 3 years, something like that.
That's true.
And how many times did you go to the emergency room for falling?
At least 4 times.
4 times in about 2 years.
Yeah.
Okay, so you're diabetic, and your sugar was up in the 300s on 100 to 120 unit of insulin, which is very, very severe. Okay, so how did you hear about us?
On the radio.
On the radio. So you came to us, you take you what, 4 hours one way, you said?
Yeah, but when you said you weren't going to be on the radio station anymore in Glendale, then I decided I have to go. So then I made arrangements to come on the bus, and then I came on Access, and it took me 4 hours to go.
One way, correct?
One way, until I found out about the train.
Oh, that's much better. Okay, but you did for a few years. You spent 4 hours one way to come see us. Okay,
that's true.
Why do you come when you take so long to come? What happened the first treatment that I gave you?
I was amazed I could bend over.
Bend over after the first treatment.
And bend over, and I didn't have pain.
The back pain was gone.
Right.
Did you fall any more after my first treatment?
No, I haven't fallen at all, except for to bruise this elbow once crashing into a wall.
Okay.
Losing balance.
So we treated your diabetes, and one time you were only taking 4 units of insulin, and your sugar is like 100 to 130, 140.
That's true.
And then Dr. Elaine did not scold you, so you start indulging on your food.
That's
you gain
true.
a little too much weight.
That's true.
Okay, so how much are you taking right now? What's your sugar now?
My sugar was 149 last night.
Okay, but how much insulin they give you?
8 units.
Okay, so but that's still
at nighttime.
It's still a big improvement because you were taking 120.
That was a long time ago.
And your sugar was like 300. You told me.
That's in 2007.
2007. Okay, so diabetes can be cured, but the cure has to do with the patient adhering to a right kind of diet. So Ruth cheat a little bit once in a while, and when you eat late, that's when you have the problem.
When I'm out in the street and I take buses home late at night, then I tend to eat late.
Okay, now tell us the improvement on your eyesight. What were you able to and not able to do in the past because of your legal blindness?
I could not see the don't walk sign or the walk sign to cross the street, and I have to wait for somebody to come to follow them across the street.
And you use a cane?
Yeah, I use a cane all the time.
Uh-huh. And now do you still use a cane?
Only when I go up and down curbs I'm not familiar with to see how high they are. Mm-hmm. And sometimes on the stairs.
Okay, so you do not need to wait for people to move, and you can see the walk sign now?
Yes.
How about the clock in the bus? Were you able to see it before?
No.
Okay, how about now?
I can see the date and the time.
Mm-hmm. Okay, today you told me a new problem that you have since you were 17.
Inguinal hernia in the lower right quadrant.
And what are the symptoms?
Pain and not being able to constipation, not being able to eliminate.
Okay, I gave you one treatment.
For days.
Okay, I gave you one treatment for the hernia. So
right.
How do you feel?
I feel a lot better. I don't have the intense pain. I have a tiny little pain, but I don't have that intense pain and I can walk better.
Okay, so I expect your bowel movement to be better because the pain means you got blockage of circulation.
That's
So when I get rid of that, okay, if you pay attention to your diet, your diabetes, your inguinal hernia, because they're all related, okay, you become a little more disciplined. Your diabetes will drop. Today I really treated to send circulation to your pancreas. You got to do your part. Okay?
Before I did my part, I can do it again.
Exactly. Yeah, you were doing all your own cooking and stuff like this. What else did we help you? And anything else?
My low back pain's gone. My sciatica is hardly ever there, and I have pain sometimes in my right rotator cuff, but I think that's from surgery on my neck.
Yeah, too much surgery. But in any case, anytime you have pain, how long did I take to get rid of your pain?
Here, it goes away right away.
Every treatment.
Every treatment goes away right away.
So chronic pain are extremely easy to cure just by opening circulation. This is how I also cure diabetes. You send circulation to restore the function to the pancreas, to restore its function. So it secretes its own hormone, the insulin. Now you're taking clonidine and also thyroid. Okay, so let me get your thyroid and also the pancreas get better. Okay?
I appreciate it.
We'll follow you on the hernia, the blood sugar next time. I
Right.
expect it to be next week to be lower.
I'll
Okay?
write it down.
Okay, all right, good. Thank you.